Hey guys, Dr. Whitney Bowe here. Today we're going to be talking about the lip flip. What is it and why is it trending right now? And how can you achieve it and how much does it cost? So for those of you who don't know me, I'm Dr. Whitney Bowe. I'm a board certified dermatologist in New York. I treat a lot of faces that I'm sure you would recognize. My practice is currently capped. I can't accommodate any new patients, but I love educating people who are thinking about getting some procedures done, or even people who are thinking about doing the procedures themselves, people who are learning different injection techniques, etc. And I also love talking about a comprehensive and integrative approach to the skin, because I do view the skin as a window into your overall health. So I have lots of videos and love to talk about what we're eating, our diet, our stress, and how all of those things impact the skin. So if you find this video useful, be sure to subscribe, share it with others who you think might benefit from this information. So whether you just genetically, have thin lips, or you're someone who maybe you've lost a little bit of your lip volume over the years, and you just feel like your lips are almost like caving in or collapsing on one another, a lip flip may be something that you would want to consider doing or asking your doctor about. So when it comes to a lip flip though, the cost is very low. It's really only about $100 or less. But there are risks involved, especially if you're going to somebody who doesn't really know what they're doing. I know some of you guys are potential patients, others of you are experts and want to be injecting and sort of advancing your injection technique. So I'm going to sort of speak to both of those things when I talk about the lip flip. So when I do the lip flip, first of all, this area is very, very sensitive. The area around your vermilion border and your lips has a lot of different nerves feeding that area. So you really want to use the tiniest needle possible for the injections. I use a little baby tuberculin syringe, and that allows me to do two things. One, it minimizes the pain, but it also can allow me to just administer very, very small quantities, and that's really key here, because you only want to be putting, again, half to 1 unit, per area. And when you inject, you want to keep those injections very superficial. If you inject too much, or if you inject in the wrong area, a couple of things can happen that are not so much fun for your patient or for yourself if you're getting it done. One of the things that can happen is that it can look like you have Bell's palsy. You can actually get an asymmetry. I've seen patients who have asked to get this done by an injector who didn't really know what they were doing, have a drool, so the corner of the lip went down, and they can't actually prevent themselves from drooling. There are people that I've spoken to who play the clarinet or the flute, and when they've had it done poorly, they can no longer play those instruments. It's hard to whistle, use a straw, kiss. There's a lot of issues when you can't have full function of the muscles around your lips. It can slurring your speech. The list goes on of potential side effects. Now, I don't mean to scare people, because luckily, knock on wood, that's never happened to any one of my patients. Because if you're injecting very small doses in very superficial locations in the muscle fiber, strategically in the right locations around that vermilion border, you won't experience any of those problems. But the downside of that is that it's not lasting very long. So anyone who's ever had Botox or Dysport injections knows that the duration of effect has a lot to do with the quantity that's being injected. And because we're forced to use very low doses in this area for good reason, you don't want any of those side effects, it's really only going to last about 2 months. So, when you think about having a more long-term sort of lip flip effect, I would consider combining those injections with a little bit of very naturally placed, beautifully placed lip filler, really just to evert the lips in a more meaningful way. You don't want to have a duck lip. You don't want to have anterograde projection, meaning you don't want to keep filling. If you keep filling in the wrong places in the lip just protrudes forward and it looks like a duck, okay, or a platypus. Lip filler technique is so critical, because what you want to do is you want to evert the lip a little bit and make the lip look like it's just really hydrated, almost like you're wearing lip gloss all day long, but you don't want to keep adding in the wrong places and project forward a lip. It's a terrible look. I will have to do another video about the lines around the lips and about the corners of the mouth as well. Resting bitch face, anyone? So if you guys have questions about that, send them my way and I'll try to include them in the next videos. All right, be well, stay safe. And again, if you found this video helpful, please do share it with somebody else. Okay, bye.